From Vermont Public, this is The Frequency. I'm Mitch Wertlieb. It's Monday, March 10th, and here are today's headlines. A group of potential buyers for a Northeast Kingdom ski resort is accusing the man in charge of the sale of ignoring their bid. But the court-appointed receiver in charge of Burke Mountain, Michael Goldberg, says that's not the case. Instead, he counters that after 9 months of discussions, the group lowered their bid at the last minute. Todd Firestone is with Green Mountain Ski Partners, the group looking to buy Burke. He says they lowered their price from $12 million to $10 million after the sale process dragged on for months.
And during that time, there was another year basically of, more deferred maintenance, primarily at the hotel.
Goldberg, the receiver, said in a press release last week he was close to finalizing a deal to sell Burke to another buyer. They have, quote, deep roots in the community and are committed to putting millions of dollars into the resort, according to Goldberg. The resort has been overseen by Goldberg for nearly a decade now. He took over after federal regulators accused the former owners of perpetrating the largest financial fraud in Vermont's history. In other business news, a major Franklin County manufacturer has announced it will close by 2027. Perrigo makes infant formula at its Georgia plant. But a company spokesperson says the facility is no longer cost-effective due to its age and, quote, evolving regulatory requirements. In the meantime, the Franklin County Industrial Development Corporation plans to talk with the state about what else could go in the building. Tim Smith is the nonprofit's executive director.
There's a lot of trickle-down effects that will be impactful for the region for sure. And if we can stem that tide a little bit and be able to use the facility and the infrastructure, the impact will not be as great.
According to Perrigo, the plant closure will impact about 420 employees. The state has started to meet with Vermonters to determine how it can cut down on the so-called digital divide. Brittany Watson is with the Vermont Community Broadband Board, and she says the board wants to find out who needs computer equipment and training to better access the state's new high-speed broadband network.
Digital equity's role is to ensure that every individual in Vermont has the access, the affordable technology, and the skills to be able to be on the internet and navigating it meaningfully and safely.
Watson says the state hopes to use part of its $5.3 million federal grant to give out refurbished equipment and train low-income residents and senior Vermonters who need help using the internet. And the University of Vermont women's basketball team hopes to advance to the finals of the America East Conference Championship tonight when they tip off against the Bryant Bulldogs at Patrick Gymnasium. The Catamounts won their semifinal game with a 70-39 rout of UMBC last Thursday night. Sophomore center Nicola Priata led all scorers in that game with 19 points. Whoever ultimately wins the America East Championship will advance to the NCAA tournament. Coming up. Healthcare is expensive all across the country, but Vermont's prices for health services delivered in hospitals are especially steep compared with other states. Brave Little State delved into why, and we'll hear an excerpt from their latest episode on the topic after this.
Thanks for listening to The Frequency, where support comes from VITA, supporting business growth and innovation in the Green Mountain State. From agriculture to manufacturing, energy to food production, find solutions that turn your business dreams into reality. Visit VEDA.org and see how VITA can help make it happen.
Around the country, prices for health care delivered at hospitals have grown faster than prices for child care, housing, and even college tuition. But there's evidence hospital prices in Vermont are especially high compared to other states. On a recent episode of our podcast, Brave Little State, reporter Josh Crane looks into the reasons for high prices at the state's biggest hospital, the University of Vermont Medical Center. In this segment, he explores one factor in particular, so-called market power.
When you only have one major provider serving most of the state, they get to charge the prices they want to charge.
This is Alex Garlick. He's an assistant professor of political science at the University of Vermont and the author of a forthcoming book about healthcare lobbying.
While the Care Board is looking at this as hard as they can, and the insurance companies are trying to limit premiums, ultimately the price of the services are what matters. And UVM Medical Center charges the prices that the market will bear, which are relatively high.
Research supports this idea. In basic terms, fewer hospitals competing with one another means they have more control of the supply for healthcare services. And since there will always be demand for healthcare services, this gives hospitals leverage. The UVM Health Network, which includes the UVM Medical Center, says it was formed to preserve access to care, and that the alternative would not be more competition, but less access to care overall. According to Alex Garlick, though, if you're wondering why Vermont healthcare prices are so high, even compared to our neighbors in New England, market power is a factor.
And if you look at some of our other peer states in the region, like New Hampshire or like Massachusetts, they have competition from their healthcare providers. There's no such competition in Vermont, and so there's very few limits being placed on prices going up from the market to slow it down.
Few limits, but not no limits. That's where the Green Mountain Care Board comes in.
The recent showdown between the Green Mountain Care Board and the UVM Medical Center is the most important thing to point at.
Well, new this morning, the Green Mountain Care Board has reached a conclusion in their budget review for fiscal year 2025, and Vermont hospitals are taking budget cuts. Overall,
last fall, the Green Mountain Care Board concluded their budget review for all 14 Vermont hospitals. They approved a budget for UVM Medical Center that was bigger than last year, but smaller than the medical center had proposed. And they also did something unprecedented in the board's history: require UVM to reduce commercial prices by 1%. The Care Board said they found the UVM Medical Center's budget proposal to include higher than necessary commercial prices, and instead urged them to address inefficiencies in their spending. It was the first time since the board was created in 2011 that they ordered a hospital to reduce commercial prices. The UVM Health Network released a statement saying they disagreed vigorously with the Care Board's decision, and it wasn't long before they announced some news of their own.
Citing recent budget orders from the Green Mountain Care Board, the UVM Health Network announces cuts to a range of patient services.
Cuts to the number of patients admitted to the UVM Medical Center and to an inpatient psych unit in central Vermont, and consolidation for primary care and rehab clinics in that area as well. The announcement also mentioned cuts to administrative services, and that the health network would stop running kidney dialysis clinics around the state. CEO of the UVM Health Network, Dr. Sunny Eapen, described these as cuts they were being, quote, forced to make. But the announcement sparked outrage among patients, lawmakers, and even staff across the UVM Health Network. One of the main concerns was the impact on some of the state's most vulnerable residents.
Providers at Vermont's largest hospital taking to the streets over proposed cuts to patient services.
Nurses and staff at UVM Medical Center held a march and rally today in protest of program cuts announced by the UVM Health Network.
Hey, hey, ho, ho, reverse the cuts, they got to go. Hey, hey, ho, ho, reverse the cuts, they got to go.
UVM Health Network ultimately decided to keep operating the dialysis centers, though they went forward with the rest of the cuts. Now, the UVM Health Network brought in close to $3 billion last year, netting about $86 million after expenses. It was a rare financial positive in a state where most hospitals are operating at a loss. This is one of the reasons the cuts struck such a nerve. I asked UVM Medical Center President Steve Loeffler about this. What would it take for the UVM Medical Center and the health network more broadly to get to a place where you can lower commercial prices to more affordable levels without cutting patient services? What would need to happen?
So we work on that every day. We're working on it now. We keep cutting administrative expenses down as much as we possibly can. There is a limit to how much administrative expense you can cut. There's only a little bit you can do around those edges.
The UVM Health Network reports they've reduced administrative costs by about $40 million over 2 years. But they say cuts to patient services are still needed sometimes, regardless.
In a very rural state where oftentimes the volume of service is lower than what would be optimal to break even, we're going to have some give and take.
I asked Steve where that $86 million earned from operations last year goes.
It's very, very important in any kind of business. And healthcare is both the important things we take care of people, but it is a business in some ways, is we have to have money left at the end of the year to reinvest in the people that work here, in the tools and equipment we use to take care of you, to upgrade and keep it new and current, and to keep our facilities new and modern.
Facilities, equipment, and people. Reinvesting in people included bonuses for executives last year. UVM said its decision to give those bonuses was based on national benchmarks.
That was an excerpt from a recent episode of our podcast, Brave Little State. Learn more about the high cost of healthcare and find answers to all your questions about Vermont in your favorite podcast app. Thanks for listening to The Frequency today. We had additional reporting from Liam Elder-Connors, Elodie Reed, Howard Weiss-Tisman, and Nathaniel Wilson. Our executive producer is Kevin Trevelyan, and our music is by Blue Dot Sessions. I'm Mitch Wertlieb. Talk to you tomorrow.
Each morning, it's a new opportunity, a chance to start fresh. Up First from NPR makes each morning an opportunity to learn and to understand. Choose to join the world every morning with Up First, a podcast that hands you everything going on across the globe and down the street, all in 15 minutes or less. Start your day informed and anew with Up First by subscribing wherever you get your podcasts.